Ontario health experts say we are now in the 6th wave of the COVID-19 pandemic, with case counts and hospitalizations rising. One local medical officer of health says it's due to a combination of lifted public health restrictions and March break. Celebrations during March break, that is. Sylvie Lenve has a story.
If you're taking a look here in Niagara, over the last couple of weeks, we've seen about a 2.5-fold increase in people hospitalized for COVID-19.
Niagara's medical officer of health says Ontario is already in the 6th wave of the pandemic. Wastewater treatment data from the COVID-19 Science Advisory Table shows that COVID cases are increasing across the province. This curve in the Central West region, which includes Hamilton, Niagara, Norfolk, Haldimand, and Brant, is going up, and so is the one in the GTA. Dr. Mustafa Hijri says this 6th wave is mainly caused by 2 factors.
The measures that were keeping us safe from COVID-19, that were preventing its spread both in the community but also in schools, have been taken away. I think a second part of this is, of course, we're just coming off of the March break, and a lot of people traveled there. I think a lot of people are up to social activities there.
People here in Hamilton have differing opinions about a possible 6th wave. Some are completely over the whole thing. Others are staying cautious.
I had COVID when I was 35 weeks pregnant with my daughter, so no, I'm not concerned about it. I think it's just like a regular cold and flu. I fought it the same way I fought any other cold or flu.
It's bound to happen, I think. I mean, just with the mask mandate coming down, it is what it is. I mean, it's been around now for 2 years, so I don't know what to say anymore. I mean, it's part of life.
People think it's over, and I think they have it in them, and they're going to be spreading it one after the other.
I really hope that we're not going to, in this 3rd period of this pandemic, basically give up our lead. I hope we can really redouble and make sure we do the things that we can do that aren't actually that difficult to make sure we can protect the people around us.
Hijri says he wants to keep Niagara's policies in line with the province's, but says Niagara Public Health won't hesitate to implement a mask mandate should there be a large spike in hospitalizations.
I'm absolutely over it. I'm done. I just can't do the masks anymore. I can't do the lockdowns anymore.
Well, my parents are elderly. Yeah. My father has cancer. My mom just had surgery, so I find it important to help with their health.
I think they should go back to wearing masks until it's completely over.
I think when you're in close proximity, it's a good idea. It's all about responsibility to yourself, what you think, and what's best for everyone. I mean, everyone's got their own opinion. Science is science. I mean, it is what it is, and you go from there.
Dr. Hijri says COVID-19 treatments could help keep hospitalizations down, particularly for those who are vulnerable or elderly. He says to consult your healthcare provider to see if you're eligible for those treatments and to do so as soon as you're infected.